The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Welcome to Generations Radio, where the focus is on our seniors and their families. We are here each Saturday afternoon from 5 until 6 p.m., bringing you resourceful information with our radio team of professionals in the field of aging. Stay with us for the next 1 hour as we explore different ways to make life more exciting and meaningful for our extraordinary seniors. Right here on AM 690 The Answer. And now, here is our host and the publisher of Generations Magazine, Percy Ihara.
Good afternoon and welcome to Generations Radio. I am Percy Ihara, your host here every Saturday. So thank you for joining us during this holiday season. I know everybody's busy, the traffic's bad. And what's really interesting is that I just noticed Christmas shopping is kind of down, don't you think? And I think so. I think they're promoting, Black Friday so much that once people bought on Friday, they're done for the whole season. In fact, I was at one of the major retailers and said, if I don't buy today, are there going to be good specials later on before Christmas? And the person who kind of shocked me says, no, this is the big sale of the season. I said, really? So anyway, welcome to the show and happy holidays to you. Hope you're doing well. And as always, I always say, live well. Anyway, we got one of my favorite guests here, one of our local experts for the magazine, Martha Khlopin, our Medicare specialist. Welcome to the show, Martha.
Thank you, Percy. Happy to be back.
Yeah, I know you have a show, which is great. Now, tell our audience again, what time is your show? Because yours is a great show about Medicare.
Thank you, Percy. My show is on Saturdays at 2 p.m. on KHNR 690 AM, and also Sunday it repeats at 9:30 a.m.
In the morning.
Yes.
It's a half an hour show. It's called Medicare Moment with Martha.
That's correct.
Great, good for you. So, Martha, we've seen a lot of changes in I love the paper, and I advertise my mortgage business in the paper, but I've seen some disturbing articles about Medicare.
Yes.
And there's been changes going on, and we don't want to talk about specific plans, obviously, but
right.
Why are these changes going on?
Well, you have the baby boomer population, Percy, which you're probably a part of.
Yes, I am. Absolutely.
And so there's more use of the system, more utilization of healthcare services. So every year, Medicare takes a look at what the utilization costs for the Medicare programs are. And then they actually have to increase the Part B premiums sometimes and other things to make sure that they'll have enough money allocated to cover everything.
And so let people know I'm not Medicare age yet. I'm 10 years away.
That's right.
But I know I was talking to a planner yesterday that, they're 60. Their client's 60. In fact, he emailed me 7 o'clock last night. He goes, they're 60 and they want to retire at 62. What are some of the things we got to start planning for? I said, first of all, Social Security, whether they're going to take Social Security or not. And then when they're 65, they got to start thinking about, right, Jack? Medicare plans. And, I was talking to someone else just this morning about that, how his dad's on Medicare. This guy's younger, obviously. And some of the complications or some of the issues, how to decide.
Right, exactly, Percy. And I'm glad you said that. One of the notes that I put together here is it says the pros have to learn. The pros have to learn Medicare. And then I say, why? Why do the pros have to learn? Because if the people that you are talking to about your financial things and so on and so forth, your insurance, if they don't recognize that they need to help you, then you could possibly have a coverage in health insurance when you're qualifying for Medicare. A lot of people don't quite understand that they're entitled to pick up their Social Security cash benefits at age 62, but the Medicare health insurance doesn't kick in until 65. So what do you do if you've retired from work and you no longer have work through an employer and you're not covered under a spouse's employer? You got to do something for those 36 months before your Medicare kicks in.
What I've seen recently, some of the hotels and big name companies here, is that they negotiate when they retire. Because a lot of times they want to cut out the high paying employee, right? They negotiate that they pay until they reach 65.
Right, and there's
pay
also
their medical insurance.
Right, and there's also COBRA that is available for people who are terminating and they don't have coverage, but that's good just for 18 months. So you still would have a short, exactly. So you still
Is it always 18 months?
Well, it's typically 18 months. It may be some differences depending upon the situation, but that's the rule for the COBRA coverage. But in many cases, people don't realize that there'll be a big gap between the time that they maybe actually retired and lost their employer coverage and they become became eligible for their Medicare health coverage. Now, if you are disabled, then you don't have to wait until 65. Typically, in your 25th month of receiving disability income, you become eligible for Medicare. And for certain other conditions, Medicare is automatic. So very important to understand those differences.
And another thing that people really need to understand, this younger person I was talking to today, their father evidently makes pretty good money, and he didn't take Medicare right away.
Oh.
And then this person said, you guys, you should tell Medicare, they need to put in a thing. It's mandatory that you get Medicare. I said, it's not really mandatory, but there is a penalty if you don't apply.
Exactly.
Their father did not apply for 2 years.
Oh, okay.
It's not a lot, but it adds up.
Well, it is. It's 10% for every 12-month period that you could have enrolled but didn't. So if your income, and also if your income is above a certain level, $170,000 for married, filing jointly, $85,000 for single, you also get what's called an income-related Medicare adjustment.
Oh, that's right. When you make more money than how much? 170?
Exactly, for married filing jointly. So you could easily end up having a penalty. And if you add the, income related adjustment, and then if you add the penalty on top of that, you're talking about a little bit of money there. And also, Percy, I don't know if you heard this, it was just released, but the Medicare Part B premium in 2015 is $104.90. That's the standard Medicare premium.
15 or 16?
For 2015.
Okay.
And 2016, it's going up
to
$121.80.
So that's how much was that? What was it? 2015?
It was $104.90.
104.
$104.90 is the standard Medicare Part B. Now, what's so interesting about that is, I don't know if you heard, but Social Security decided not to approve the cost of living adjustment.
I just heard that just the other day when I was meeting one of my clients.
So this is an interesting one, Percy. You're going to love it. So there's actually what's called a hold harmless provision. So if Social Security does not increase your Social Security benefit, monthly benefit, then they cannot raise your Medicare Part B premium.
But it is.
No, if you were getting it deducted from your Social Security check in 2015, because there will be no cost of living adjustment, you will be grandfathered under that hold harmless provision that very few people know about.
But most people do already get the direct deposit, right?
Well, not everybody does, Percy. So yes, so if you're getting it deducted from your Social Security check, then you will indeed be grandfathered, and you will continue to pay the standard Part B if that's what you're paying. If you're in penalty phase, you'll be paying whatever it is. But for people who are just starting to collect their benefits starting January 2016, the higher amount will be deducted, $121.80. But it gets even better, Percy.
Oh no, please, not more bad news.
Now, there's a lot of people who've decided to defer getting their Social Security benefits to what we call full retirement age.
67, 68.
Right. So you can first get your Social Security at 62, but you can delay full retirement age or beyond. So in some cases, those people have elected to pay for their Part B, when they turn 65.
Right.
However, it does not come out of their Social Security check because they opted out of getting the benefits.
Right.
So for those people, if you are billed directly from the government, you are subject to the higher amount. There's no grandfathering for you.
And how much is that? 120?
That's the $121.80.
Wow.
Right. So very, very interesting that you could be in a household, you and a spouse, and one spouse who elected to take their Social Security and they're having their Part B, elected for their Part B, they're having that $104.90 deducted. And if you're new to Medicare and you'll start paying your premium in 2016, it'll be a different amount for you. I've already started to get the calls on this, Percy. People calling me saying, Martha, I don't understand. The Part B premium is $104 and I got something for $121.
That's per month now. It doesn't seem like a lot, but per month over years time.
Well, and a couple.
And so it's per person.
It's
right? Not
per
just a couple.
person. Absolutely. It's per
that.
person. Exactly. So that is something I've been receiving a lot of phone calls about, people not understanding that the Part B premium for 2016 is rising for people who are not grandfathered.
Yeah. Well, if you're wondering and listening to the Generations Radio show today, you're probably wondering, what is this complicated, confusing topic we're talking about? And it's Medicare, ladies and gentlemen. And we're here with our local expert, Martha Khlopin. Now, Martha, thanks so much. And I know you want to give a shout out to the class of
1969.
And you'll be doing all these
workshops for Roosevelt, McKinley, Kalani is coming up next month. And I absolutely love working with the class of 1969. And many of them, Percy, many of them are turning 65 next year. A few have turned 65
Right.
already. But they're turning 65 in 2016, and they don't know the first thing about Medicare insurance. They've been working, they're planning to continue to work, and they don't even know what they need to do. So it's been really a pleasure to be able to assist them with understanding their specific situation and giving them information specific to their situation. Medicare happens, but it's not cookie cutter. It's not cookie
Right.
cutter.
Well, I got to give them a lot of credit. I know they read the magazine.
Yes.
They love the magazine, and I give them credit for calling you up to come down and do a workshop, because a lot of classes don't do that, and they don't want to wing it, or they don't decide until a month before they turn 65 that maybe I better take a look at that.
It's so true, Percy. They were very, very excited that you've been featuring me with the Medicare moment with Martha, whatever the column is. They've been reading a little bit about it, and then they realized that because you put that in your magazine as well, contact these experts for workshops. So that's exactly what happened.
Oh, good for you. Well, so hopefully some of these ILH schools will be there, and maybe you better do a webinar for Neighbor Island schools.
It's a good idea.
Really, because it is complicated. I mean, I've been doing this for almost 12 years now, and I'm still confused. And now I'm hearing changes that oh my God, I don't want to turn 65 now.
I know, but it's a good idea to do that.
No, it is. I mean,
turn 65. You may not like the insurance part, but
Right.
good to have those years.
Well, we're here at Martha Khlopin, our Medicare expert, and thank you so much for starting the Miss Medicare pageant in 2014.
Sure.
And you had one this year, 2015. And we featured them on our October-November issue,
It's
right?
beautiful.
The three beautiful
Yes,
ladies.
beautiful.
We had Lori Bachran on the show, and boy, she just wows a lot of people. And we get 2 calls from males saying,
Wow.
"Oh, she's
Dating
she's single." Yeah, she's beautiful. Like, well, don't ask me.
All of the above.
She is. I was surprised, or not, shouldn't be surprised. She doesn't take any medication either.
No, she doesn't. Nope.
86 and a half years old.
86 and a half. And she always reminds me to let folks know 86 and a half.
Yeah. Faye Roll-Shock. And then we had Miss Terry Rainey from Maui. Beautiful lady.
Yes,
So thanks,
very
ladies,
beautiful.
again. And if
I
you got
will.
to check it out, go to generations808.com. Look on the right side for our archive section, and then you click on the October-November issue of Generations from this past year. But anyway, Martha, so we've seen a lot of we always see fundraiser
Right.
events and people that are on Medicare. And
Right.
somebody asked me a question the other day. If they're on Medicare and they have like a heart attack, an aneurysm, stroke, cancer, doesn't Medicare cover all the cost of care?
And the
And the
answer
answer
would be
is?
no. And I'm glad you asked that question, Percy, because a lot of people, especially if they've been working and they're accustomed to a commercial plan, they really don't understand that Medicare insurance works a little bit differently. And you do need to really research your options and understand what's available to you when you first qualify for Medicare. So something that doesn't get a lot of airtime or talk time are these Medicare supplemental programs. The way that they work is they supplement what original Medicare doesn't pay. Most people don't understand that original Medicare, when you show your red, white, and blue card for hospital or for the doctor, after deductibles, it covers about 80% of your Part B services.
And Part B is with doctor visits.
Lab work,
Okay.
things of that nature. So 20% can add up to quite a bit if you have a chronic condition.
Absolutely. Chronic, major aneurysm, stroke, heart attack, cancer patients.
Yes. So within the first 6 months of becoming eligible for Medicare, you're allowed to get one of these Medicare supplemental plans for what's called guaranteed issue. So they don't look at your health condition. They don't look at anything. Guaranteed issue within 6 months of qualifying for Medicare.
Anyway, back up. So when you first turn 65, you need to apply and get it.
Within the first 6 months. That's
And
right.
the advantage is
Anything that original Medicare doesn't cover will be picked up by the supplemental plan. So in the event that, I have a gentleman who was diagnosed with end-stage renal disease, and his dialysis is $24,000 per month.
Oh.
And his out-of-pocket without a supplemental plan would be 20% of that 24,000. I have a hard time even saying the number. Yep, $5,000 a month is what his out-of-pocket would be if he did not have the supplemental plan. And if he attempted to pick up a Medigap supplemental plan after he was diagnosed, he would not have been able to get it.
So the advantage, besides covering the 20%, is really now you said your guaranteed issue.
Right.
So in other words, if you don't, let's say at 67 you decide to get it, you have to qualify?
Well, the key is the first 6 months that you become eligible. So if you have been covered under a commercial plan, you're still working at 67, it's 6 months before you become eligible for your Medicare. So you could be 67 and still be within the window. But if you retired at age 65 and you went on Medicare and you did not pick up one of these plans, you would be subject to underwriting. So the premium, rather than being guaranteed issue, you would be subject to underwriting. So the premium could be sky high, or you might not be accepted at all.
So, see, you got me confused again. So you have the guaranteed issue plan, and that's what's called a Medigap program?
That's just the guaranteed issue. Okay. It's just what your rights are when you first become eligible for Medicare within the first 6 months of eligibility. That's when you can get guaranteed issue of your
that's called a Medigap plan?
It's called Medigap or Medigap Medicare supplemental plan.
Supplemental plan. And how much does that cost a month? Does it vary? How much?
It varies, but when you have guaranteed issued, it's based on your age and male or female, and that's it. Guaranteed
no income?
Issue. Nope. No income.
How much is that?
I've seen plans this season for about $159 per month.
$159 a month on top of the $121.
That's correct.
So that's almost $300 a month.
Yes, and then also Medigap supplemental plans don't include prescription drug plans, so you'll have to pick up a separate drug plan, a separate Medicare drug plan. So it can easily be close to, maybe $325 per month for original Medicare plus the supplemental. But one very important factor, Percy, is you would not have any cost sharing on your medical benefits. So if you needed to go, well, if you needed to go into the hospital, where normally you might have to pay $200 a day or $500 a day, it would be picked up by your Medicare supplemental plan.
Oh, okay. Mm-hmm. So what are these? This famous term is a Medicare Advantage plan.
Right. Medicare Advantage plans work a little bit differently. They do not pick up the entire cost of whatever Medicare doesn't pay. It picks up a portion of the cost.
80%?
No, not 80%. Typically,
more or less.
Typically, you will pay less out of pocket with a Medicare Advantage plan. So, for example,
less out of pocket.
Mm-hmm, less out of pocket with a Medicare Advantage plan versus original Medicare.
But you still got to pick up you have to get a Medigap program with the Advantage?
Well, you cannot have both the Medicare Advantage and Medigap together. You cannot have those two programs together. You have to decide whether you want to be able to have everything covered outside of the drug, or you have to decide if you want to do Medicare Advantage, and sometimes they cover medical, doctors, and the prescription drugs all together.
So, HMSA obviously is 80%. You pay 20%, which I have. And there's a Kaiser plan where you pay a premium and they cover everything. So is there a Kaiser Medicare plan cover everything as well?
No, Kaiser Medicare plans are subject to the same rules as every other private plan that offers Medicare. So even with your Kaiser, you would have a cost sharing when you see a doctor or when you have certain services. So you still have additional money to pay, even if you have a Medicare Advantage plan, whether it's Kaiser or some other plan.
And the Part D, the what is it called?
That's the prescription drug.
Mm-hmm. That's a separate cost as well?
That's a separate cost if you do it outside of a Medicare Advantage plan. Say if you're going to go with original Medicare, pick up a supplemental to cover the 20%, and then you can pick up a drug plan for your prescription drug side. But many of the Medicare Advantage plans will include the drugs within the one plan.
So I opened a big can of worms. I'm almost more confused. If you want a Medicare plan that covers everything, you have to get the Medicare Original.
Yes.
With a Medigap.
Yes.
And a prescription Part D.
Excellent. You have it Percy.
You don't
Great.
need. What about the rest of the B, A, C, D, E,
Well,
or whatever?
the original Medicare is your Part A and B. So you're using your original Medicare with a supplemental plan to pick up the 20% of your Part B that original Medicare doesn't cover, and then a standalone drug plan to take care of your prescription drug needs.
I got it.
So that was good.
Wow.
You passed.
Okay. So remember the other day I called you and I said, my friend called me at 7 o'clock at night the other night saying, my father is military, so he was at Tripler.
Yes.
And then he's got to put the father, he's rehab.
Right.
So they recommended a facility, a state-run facility, and they're not happy with the service. So he asked me, can I put him someplace else? I said, good question, but I know somebody can answer. So I called you up. So explain to me, like my father's military.
Okay.
As people know. He goes to Tripler, but he also has what's called TRICARE.
Okay.
Where he can go to other places, right?
All right.
But then, so my friend said, now you told me that if he's at Tripler on a specific Medicare plan or military plan.
Right. Well, this is what I tell people when they have the military plan. When you're over 65, you're typically required then, in order to keep your, TRICARE or other military benefits, they require you to pick up your Medicare Part A and your Part B.
They're going to pay it themselves?
Absolutely.
But I thought if you're military, they cover that for you.
Well, Percy, nope. maybe once upon a time.
Wow.
But not anymore.
Okay, so then, now you told me, now correct me if I'm wrong,
okay, that
Tripler had us, I guess, he was asked to go to a specific state-run facility for rehab. They didn't like it. And you said, so he asked me, what options does he have?
Right.
Because he don't like the facility that he was told to go to.
Right.
What options does he have?
Right. Well, the key is, let's say his condition is related to a military injury.
It was not.
Okay. So then if he has Medicare Part A and Part B, original Medicare, which I'm sure he may have, then he can appeal to Medicare and say, I want to change facilities, and then see if the facility that he wants to go to takes Medicare, and it's a possibility he may be able to make a request that he change facility. So the most important thing he needs to do is contact Medicare at 1-800-MEDICARE and discuss that with them, and they'll be able to tell him whether or not another facility to his liking he may be able to change to it.
So can he just call Tripler, or whoever the doctor, or whoever the nurse over there? Wouldn't they know?
No. You need to call Medicare. Really? Because it's Medicare. You have certain beneficiary rights and protections under your Medicare plan, so it's Medicare that you need to start with.
Okay, so let's say they call Medicare and say, okay, that's the only facility is that true? He only has one facility to go to?
If that's what Medicare says, then yes, I would say that is true.
Really?
However, when you have these Medicare Advantage plans, let's say, they may have other providers in the network, so there may be more to choose from. I don't know the specific situation.
It was a general question.
But if it's just a question, it's not where it has to be approved by the state or VA or something. When you have a Medicare Advantage plan, they definitely have more than one provider. So it opens up a list of providers that you may be able to change to. But a lot of, when it comes to rehab and nursing home, it's based on bed availability. And as you talk about all the time,
I was telling him about that. Unfortunately, it's very difficult on his family, his siblings have to deal with that. Right. Mom's stressed out as it is, and they have to deal with that. And most of the time, his sister was dealing with that, but now she's too busy, so she's telling him, my friend, to take this on. So he's calling me at 7 o'clock at night, like, okay, David. I talked to this guy 3 months ago about this to start doing his research. And why do people wait so long until that thing hits you in the face and go, okay, you got to move out? They wait.
I know. And I got to share one last thing, Percy. I tried to send you a picture. I was at a birthday party yesterday with a 102-year-old and a 100-year-old. And I said, I'm telling everybody I know, you get your long-term insurance right now, or I'm not talking to you anymore, because we are living longer. And at some point, you will need help with activities of daily living, and no Medicare insurance covers it.
Yeah, you're right. We're here at Martha Khlopin, our Medicare expert who writes for Generations Magazine. You can check her out there. But, Martha, you got me more confused now. And we're going to talk more about the catastrophic insurance after this. And then what's going on with Medicare on the neighbor islands?
Medicare on the neighbor islands, there was a service area reduction. So there's a, yes. So
we don't want to prompt people while we go to the break now. But anyway, we're going to take a short break and we'll be right back here with our Medicare expert, Martha Khlopin.
I'm down for the memory.
We will be right back with Percy Ihara from Generations Radio. If you have any questions or want to be part of our discussion, give us a call at 296-5467. That's 296-5467. This is Generations Radio on AM 690 The Answer.
Moon Physical Therapy is here to help you back to recovery. Moon Physical Therapy is located on Ward Avenue across from Sports Authority. Physician prescribed for motor vehicle accidents, workman's comp, or that body pain that comes from rushing to play without warming up. Also event cardiopulmonary rehabilitation with our one-on-one patient care. Moon's Aquatherapy heated endless pool allows for low-impact exercise with less pain on land. We will give you the right exercises to get you back to health. Ask your doctor to prescribe Moon Physical Therapy. Moon Physical Therapy. We achieve results.
Aloha, this is Martha Khlopin.
And Al Harrington. Choosing the right Medicare plan not only saves you money, it also helps you avoid headaches and heartaches down the road.
We want to remind everyone
to listen to a Medicare Moment with Martha, Sundays from 9:30 a.m. to 10 a.m. as we help answer important questions on Medicare so you can stay healthy, wealthy, and wise all year long.
Call me at 543-2073, 543-2073.
I was an addict from the age of 13. I finally decided it was time for a change. I walked into the Salvation Army Adult Rehabilitation Center, and that got me ready for the real world. Now, I choose to be guided by Jesus Christ, and today, I'm building a powerful and promising future, free from drugs and alcohol.
Please shop at the Salvation Army family stores. With our discounted sales, your support through your purchase helps men live a clean, sober, and productive life.
Got Vegas on your mind? Get Vacations Hawaii on the line. Vacations Hawaii offers weekly 4 and 5 night Honolulu to Vegas packages, which include 3 meals daily from $6.99. Stay at Hawaii's favorite casinos: California, Fremont, Main Street Station, and Orleans Hotel. Vacations Hawaii will get you there in comfort on deluxe wide-body 767 planes with complimentary in-flight hot meal service. Vacations Hawaii's frequent flyer program gives you future travel discounts and credits. So if you're ready to win big, call Vacations Hawaii at 591-4777 or visit PointVacationsHawaii.com.
Today, more than ever, we local people are living longer than any other state in the Union, with more seniors, baby boomers, and caregivers. Generations Radio promotes the importance to be proactive as we all age. The radio team will focus on issues facing our seniors and their families, finding resources to navigate healthy aging along with financial, legal, and caregiving information. So join Percy Ihara from 5 until 6 each Saturday, right here on AM 690 The Answer. Focusing on the issues facing our seniors and their families today. Here's our Generations Radio host, Percy Ihara.
Welcome back to Generations Radio. Thank you so much for tuning in this holiday season. As you guys know, the Generations magazine December, January issues out with Father Bill on the cover, the pastor down at Molokai, Kalaupapa. And thank you, Father Bill, because he sent me a nice Christmas card, which is so cute with the other church members down at Kalaupapa. It was a beautiful picture of just the valley. And, you know, I've never been, I couldn't go to the photo shoot, but I missed the photo shoot. With my cameraman, everybody went down. Our art director, Wilson Angel, our editor, Catherine Smith, went down there and spent a day and a half there. Very sacred grounds. You have to be invited to go there as well. But beautiful pictures. Brian Suda, our photographer. Thank you, Brian. But great story. It's just amazing. You know, there's only about 5 or 6 residents left. And they will turn into a state-run facility, monument property there that people can go visit and learn about Kalaupapa and enhances disease. But thank you to Father Bill. I mean, I don't know if you read the story, but Father Bill wanted to, in his 30s, wanted to work with Mother Teresa and send her letters And then no response. And then so he figured I'll send a letter and money. So if I send them money, maybe they'll call me up and invite me to India. Nothing happened. Wow. So the following year, he said, I'm going to go to India and live there and find her and work with her. And he did. When he got to India, he didn't know what to do. He looked in the phone book, talked to people where she was working at, called the parish that she was working at, and holy behold, she answers the phone.
Oh, my goodness.
Mother Teresa. And when he told her story, he goes, I didn't receive any letters or money, but please come down here. And 25 years, he worked there for 25 years.
Unbelievable.
With Mother Teresa. Eventually found his pathway to Father Damien and Marion Cope and Hansen's disease and moved to Maui, I don't know, about 8-9 years ago. And actually, he was a pastor at our editor, Catherine Smith's church in Lahaina, Kapalua. And eventually he's been at Kalapapa now, I think 6 or 7 years.
Unbelievable.
Unbelievable story. And after 25 years, he must have been in his early 60s when he came to Hawaii.
Wow, he doesn't look his age at all.
He was in his 30s and then I think after 25 years.
Yeah.
What a great story. And so thank you to Father Bill over there. And then there was another story about 4 seniors, 60s, being canonized and are deacons in different churches around the state.
Beautiful.
And one of my friend John Haole Tamoso in Maui. And he sent me a cute picture too. Thank you for the story. I've been getting calls and emails, but these kind of stories are so uplifting. We're trying to start a new beginning as people age and maybe change careers. But just great stories, and we're so thankful for living in Hawaii, but being healthy in Hawaii as well, right?
That's right. And we are the healthiest state. I saw that statistic too. So we take top honors. Yeah.
So here at Martha Khlopin, and we're talking about Medicare, and I think I got confused the first time around regarding catastrophic insurance when you have Medicare, because not all Medicare plans cover 100% of the insurance.
That's right.
So this celebrity person that asked me about that, I better go have him call you.
Yes.
Because I said, doesn't Medicare cover all the cost of care? I said, I think there are some plans, but I'm not really sure. So I said, call Martha Khlopin. And you know who that is, right, when I mentioned that. And so you might want to go talk to this person.
Sure.
Make sure his plan is covered.
Right.
But he's over 65, so if he didn't get it right away, right, you said he has to
still
qualify
working.
Health-wise, right?
He's actually still working.
I know, but you have to qualify now if you don't apply right away.
Well, because he has a commercial plan right now, he's okay. He does not have to enroll right now. But there may be some reasons that he might want to look at that. And that's a good idea. I will talk to him because I promise you, Percy, I am going to be much more aggressive with giving information about the Medicare to people that I consider to be my friends and my circle, because I tend to be sort of like, hey, if you want to talk, give me a call. But now I'm really beginning to see that a decision not to really look at what are your best options when it does become time to consider Medicare insurance, it can have devastating impact. For example, the gentleman I was speaking about earlier, when he was on Medicare and he, very rarely went to the doctor and was pretty healthy. His family was pretty healthy. And he was diagnosed with end-stage renal disease, and his expenses will be ongoing for the rest of his life. And he's already been doing the dialysis for about 4 years. And it is $24,000 a month. And I look at, he showed me recently his, it's called his end of every 6 months he gets a summary of the expenses. It's been $600,000 for, for that's just for 6 months. So it's been $1.2 million. I'm not exaggerating. $1.2 million for the last 4 years, because that would, if you had to cover 20% of that, because he's not hospitalized. This is what he's paying for, the dialysis.
So does a dialysis center get reimbursed all that money?
That's a very good question. Does the dialysis center get reimbursed all that money? Well, when you agree to be a Medicare approved facility, you do agree to take whatever Medicare determines is the approved amount that they'll pay.
They'll get reimbursed.
Right. So you cannot what they call balance bill the member. If the member has a plan and the plan says they pay 20% of the dialysis charges, then all that provider can collect from the member is the 20%, and then whatever is the Medicare approved amount, that's what they'll be paid from original Medicare. Interesting.
So that means that they get reimbursed $600,000?
Well, I'm not sure I don't remember what the approved amount was on that bill, but believe me, yes, they are getting a very, very good amount of money for those dialysis services.
Because I notice more and more popping up dialysis places all around town.
Mm-hmm. Yeah,
and it's needed, and I get that, and I know they do a great service. So it's interesting Medicare. So I know the answer now. Medicare, yes. Not all plans cover 100%.
That's correct, and not all people realize that their medical expenses will ever start to accumulate to hundreds of thousands of dollars. It's just not in our understanding, and maybe we don't realize that we're getting closer to 60s and 70s when these things happen, and they can fix you, but it's going to cost you.
Yeah. So we're here in almost a new year, and thank you, Martha, for coming in. So Medicare enrollment period's over.
Yes.
So you've been doing this for several years now. Have you seen the change in people applying? Have you seen the change of how they coping with this?
Yes. Actually, Percy, I have noticed a big change. A couple of years ago, 4 or 5 years ago, it seems like at the start of the Medicare season, October, people were very anxious to find out what was available in the new year and to go ahead, make a decision, and enroll in a plan. What I find now with the generation that is aging into Medicare,
baby boomers,
yes, they delay, they procrastinate, and they delay.
Really?
Yes, and
besides the class of 69.
Besides the class, they reached out. They wanted the help. They're doing what they need to do. But what I find is today, people aging into Medicare seem very confused. They seem very upset. They do not like the way the program works. They do not like talking about insurance in Part A, B, C, D. They don't like it at all. And in some cases, they decide to keep their original Medicare, and then they don't pick up a drug plan, and then they have enrollment penalties, and then they're angry that they have penalties. So I'm finding that people aging into Medicare now just don't seem to really be interested in figuring out the best way to look at their choices and to enroll.
Interesting. Very interesting. So when you do the workshops, I've been to your workshops, but specifically with that class of 69, is it something different, or is it just you do a standard presentation about Medicare enrollment, why it's important to enroll, and then just do all the different ABCDs?
Absolutely, Percy. I do something a little bit different with the class of 69. They're turning 65 because many of them are already starting to get their paperwork. So sometimes they really want to sit down and talk to me about something more specifically. But what is very complicated about the class of 69 graduating classes here in Hawaii is in some cases, maybe a spouse has worked for the federal government and there is a retirement benefit available. And then maybe the spouse has worked for a private company that also provides a retirement benefit. And if you don't understand how the two programs coordinate, you may be deciding to disenroll from one or never enroll in it, and you may be losing out on a better benefit. So actually what you need to do is really understand how the federal retiree benefits work, how it works with the state Medicare or retiree benefits versus private employer, right, because they all work differently and they don't all necessarily coordinate in a logical fashion. I'll put it like that.
A lot of people say, well, what the primary is this, and my secondary is this, and my secondary covers all that the primary doesn't cover.
Well, again, when you're talking about commercial coverage, it works differently than when you're talking about Medicare coverage and when you're eligible for Medicare. So in a commercial plan, yeah, that's pretty standard. If I'm covered under my spouse's insurance and he's covered under mine, whatever his insurance doesn't pay will coordinate with mine, and one of them will be secondary, and that works out nicely. But with Medicare, it works a little bit differently. In Hawaii, we have a lot of companies that are less than 20 employees, and if you have a company that with less than 20 employees, then your Medicare will always be primary, and if it's more, if you have another plan, it will be secondary. So there's no rule of thumb with these plans at all. It even can depend on the size of the company that you work for.
Really?
Who's primary and who's secondary, which is what you do not have in commercial plans.
Okay, Martha got me confused again. So anyway, we're here at Martha Khlopin, our Medicare specialist from Generations Magazine. You can find her in her magazine, or you can listen to her show, Saturdays and Sundays, Medicare Moment with Martha. And Saturdays is 2 o'clock.
Saturdays, 2 o'clock.
And then Sundays is 9:30.
9:30.
Okay, got it. Okay, so Medicare enrollment period is over. We're going to be coming to January very shortly. Now, I'm always concerned about the neighbor islands.
Mm-hmm. Right.
I'm really concerned about the neighbor islands.
Right.
What's going on in neighbor islands?
Well, in the neighbor islands, we have had what's called a service area reduction. Service area reduction. And what that means is one of the Medicare plans that was offered on the neighbor islands in 2015 has notified its members that they will be ending the plan there. There are 2,100 approximately.
When did they notify them?
They had to notify them by October 1st.
Oh, they did?
Yes, they did notify them. It affects approximately 2,100 individuals, Medicare beneficiaries in the neighbor islands. I've been receiving a lot of calls from folks on the Big Island because there are very limited options available. In some cases, and I'm not going to mention the plans, but in some cases their option is to pick up a Medicare Advantage plan that has a premium, a monthly premium of $190 plus bucks per month. So you have to add your Medicare Part B premium, that's $104. So we're almost up to $300. And if it's a husband and wife, you're talking about $600 every month that has to go out in Medicare premiums. And then remember, Percy, when you have a Medicare Advantage plan, you're paying a premium for the plan, but when you go see the doctor, you still might have to pay $10 or $15 out of pocket. Specialists is more. There are some plans it's $45 or $50 to see a specialist.
What do you call it? A visitation fee or something like that?
Physician office fee.
Office fee.
I got to tell you about the one that has really caused an uproar. Okay. And there's two plans that are adding this charge in 2016 that they were covering it in 15. It's called a facility charge. Yes,
that's the one I was talking about. Facility. I saw it in the newspaper.
Yes, not physician.
Last week.
A facility charge. And what that means is the facility that you go to see your doctor in may charge a fee. And this was typically covered by some of the Medicare health plans here. And
they just brought this out like last week, saying it's going to change in 2016.
Well, they sent out letters. That's correct.
Okay.
They sent out letters reminding people that what they have is called every year, Medicare health plans are required by Medicare contract to send out what's called an annual notice of change. Most people see it and bury it. So it was in the annual notice of change. If you really dig deep and you had your glasses. But they did send out, I understand, another letter recently reminding everyone that they will no longer be covering the facility charge. So in addition to whatever the copay is for you to see your doctor, you may be subject to paying this facility charge.
I see.
So yes, everyone is in an uproar over that because
it came in the paper last week, and I'm like, whoa.
Mm-hmm. Yeah, and most people don't even know what a facility charge is because the Medicare plan was covering that for you.
All these nickel and dimes. Now these are dollars and cents. Wow.
Right. But the most calls I've been getting, Percy, is about people who've been impacted on the neighbor islands by the service area reduction. And a husband and wife can end up paying close to $600 for premium. That's between the Medicare Part B premium plus their premium for their health plan. And then that doesn't even include cost sharing for your prescription drugs and cost sharing when you go to the doctor, you have blood work drawn. And then another challenge for Medicare beneficiaries, Percy, is if you need to go to an eye doctor on a regular basis, maybe you have macular degeneration or some other very serious condition, you take drops. Every time you see that doctor, you're paying not the primary care physician rate, which typically can be zero or low, $10 or so. You're paying $45, $50 per visit. So if you have to see a couple different specialists, let's say a cardiologist, a rheumatologist, and also your eye doctor, if you're paying $50 a clip, that could easily be $150, every couple months. Plus, you're paying almost $600 in premiums for a husband and wife on the
Wow.
neighbor islands. So it's beginning to get a little scary because the average Social Security check for a person who retired, maybe 10, 15 years ago is around $650.
Yes, I've seen that many times with my clients.
Yeah. So it could easily be eaten up with these premiums. So change has got to come, Percy. So I'm so thankful that you have your magazine and you're at least educating people and letting them know where they can turn for help.
Well, for Medicare, you're going to call you, Martha. So look for Martha Khlopin's article, column in Generations magazine. But, the other thing I was thinking about myself, I been to several fundraisers for friends and people that have had major health issues. And somebody brought up the issue for myself, I'm 55, catastrophic insurance.
Yes.
So what exactly is that? Is that through the same carrier or is it a different carrier or they cover the balance? How do I apply?
Right. Well, there are several carriers that offer catastrophic coverage, and I think what you would be most familiar with might be sort of an AFLAC type of a situation, but you don't have to use them. There are many insurance agents here that offer catastrophic insurance, and basically it would be for specific conditions. Let's say you have cancer, and I got to tell you my cancer story. I knew this woman, and we were doing her financial planning for the year, and she was paying for this catastrophic coverage, and she said, I will never give this coverage up. And I said, tell me more. And she said, I was at work, myself and a coworker, we both found out we had cancer. And I had picked up this catastrophic coverage, and she didn't. And I wanted a second opinion, and I also wanted the opportunity to go to have work done on the mainland. And she said, my catastrophic coverage plan covered me to go get that second opinion on the mainland, and I was able to stay up there for 3 months. I didn't pay a penny out of pocket. And she said her coworker did not have that kind of coverage. Her regular plan did not cover for her to, go and have this done elsewhere. And she feels that she survived because she didn't have the financial worries, where she said that her friend couldn't heal because she was constantly worried about money because she couldn't work. So she had an interruption in her wages. And then eventually, when you don't go to work, even if it's because of a disability, she lost her coverage as well. And so she didn't make it. So she felt like catastrophic coverage is a must. So if you're thinking about that already, I highly encourage you to pursue that. That's even something, Percy, that I actually offer, catastrophic coverage and all kinds of insurance now, dental, vision. I now offer everything pretty much that an individual would need to make sure they've covered all the risks.
Yeah, I'm looking at it myself because I don't take any medication. I'm relatively healthy, but you never can tell.
Right.
We don't live perfect lives.
That's true.
So lastly, we're almost got to get out of here. The show is going to be it. But lastly, we've seen it in the paper about the healthcare connector.
Yes.
Now they converted. The state of Hawaii's one was shut down.
That's correct.
And now everybody has to go to the mainland or national website.
Healthcare.gov, or they can see me.
But didn't they extend it to Monday or something?
They extended it until December 18th.
Yeah.
17th. What day did they extend it to?
Well, today's the 17th. But I thought it was extended to Monday or Tuesday next week.
Well, that would be another extension. The first extension I got was the 17th. So they may keep doing it. Because, I was actually enrolling someone because that's something that Percy, I got licensed as a federally facilitated enroller when we didn't have the option here. But I just got certified because I like taking tests. So now that there is no longer a state connector, I'm actually licensed and certified. You can find me on the CMS site, and I can enroll people because it can be a very, complex system to try to get through. But the first deadline was the 15th, and that has passed. It's been extended. So it may have been extended again.
I could have sworn I knew, but anyway, if you're listening, just call yourself.
Right. But I got to tell you, Percy, when I was enrolling this person, something happened to me that never happened to me before. I was on the computer and we were at the site, and it said, wait. I was on the healthcare.gov site.
On the internet website.
Yes, and it said, wait. We want you to have the best experience, so you cannot continue to the site right now. However, we will hold your place in line.
Were you
A
communicating
computer
back and
put
forth?
No, it was no chat with a person.
No chat?
This was just the computer letting me know it was going to hold my place in line. I've never been put on hold by a computer, by a website. It was just like, and I was on, well, not on hold, and it said, "Oh, you can browse while you wait."
So what happened?
Yes, and so then after about 20 minutes, the what I needed to work on popped back up, and I was able to enter the person's personal data so we could continue on to pick a plan. And we were successful. We were able to get it through. But I understand that the reason they extended it is because some people just gave up in frustration because they were put in the hold queue and the time ran out. And what was most interesting, Percy, is in order for the plan to become effective the first of the month, you had to have the money in by December 15th. So that was another challenge. Oh, absolutely. So if you're enrolling on the 15th, you had to get the money in. So it was very interesting. One of the things that I did is I did an overnight, because as long as the check stayed at the 15th and it's in the envelope, I was told that it would be okay. And then also, I called, it's only Kaiser and HMSA that you can enroll with here for the Affordable Care Act plans. But I was told that they realized that they definitely needed to do something because people just would not have enough time to be able to enroll.
Wow. What an experience. Well, technology's taking over. Big Brother's watching you on the computer.
That's right.
But anyway, Martha, any parting words? We got to run to another show, but what should people be doing? Going to your workshops and are you going to put some workshops for next year?
Yes. I also, Olelo invited me to also do a weekly program, and I'll be talking about these things. If people want more information, they certainly can call me at 237-2420. That's my office number, 237-2420. That is the best number to reach me and leave a message. I could tell you what workshops I have planned for 2016, and also I can give you the schedule for Olelo.
Yeah, that's great. So thank you so much, Martha. I'm a little bit better. I am a little bit confused with the catastrophic, whether on Medicare or not. And then for my people, my age, what you got to decide whether it's on commercial, state, federal programs, right?
Yep, that's right. You got it.
Okay. Well, anyway, so thank you so much. So check out Martha's column in Generations Magazine. You can pick up a copy all around town. Best place is the State Library. We're at every little community in the state of Hawaii, including neighbor islands, Molokai and Lanai, University of Hawaii. But also really been popular is thank you for coming to our Generations 808 website. We are actually revamping our website quietly right now. Our old website's up there. Our new website got a text from my web guy just about half an hour ago saying it won't be ready to about first or second week of January. But it's going to be a revamp of website, some cool things. And we'll be bringing out our community calendar as well. So anyway, thank you so much. We'll check us out next week, every Saturday from 5 to 6, Sunday from 3 to 4. And happy holidays, everybody. Aloha and live well.